So what is schooling like in order to become a pharmacist?
So you have to do a couple years of undergrad. I think now they're changing it to where you have to do 3 years. So you have to take some undergraduate classes that are mainly science-based, and then you apply, and then if you get in, you have 4 more years of your pharmacy degree, which is 3 years of coursework, and then 1 year of rotations, where you're out in the field.
So if you could tell me more about the application process to pharmacy school, what is it like?
Yeah, so you fill out this application, which is on this universal website that applies to all different pharmacy schools. Different schools require different things. At the University of Cincinnati, they require you to give your GPA and your transcripts, so telling what types of classes you took. You have to have 2 letters of recommendation, have to go in for an interview if you're invited, where you just work with the faculty and a community member of the pharmacy community, and they ask you different questions about your application and your grades and what you think that you could bring to the pharmacy community. And you have to take the PCAT, which is a standardized exam which they use towards your application as well.
So I like to focus more on graduate school. How does this subject matter change once you enter pharmacy school? How does it differ from what you take in undergrad?
Most of our classes are science-based and math-based. We take a lot of therapeutics classes, which is where you learn what the body does to different drugs, what the drugs do to the body, how different drugs interact. So that's where we are learning our core work that we're going to be using once we graduate from pharmacy school. And then you have different classes where you learn statistics, so you can look at data that's been performed with different drugs, seeing if it's useful for different people or not useful, being able to come up with that opinion on your own rather than having someone tell you, oh, this drug is good, this drug is bad. Doing skills lab where you get to practice counseling to patients, working with different people, working with your classmates. We get to do case studies where we get a case for a specific patient and we get to apply the material that we're currently learning in therapeutics to a realistic type of case, which is something that we have to do in real life once we start going on rotations in our 4th year.
Could you explain to me the 4th year clinical rotations of pharmacy school?
Sure. So it's actually really different. Here at Hart is more of what you would think of like a traditional community setting. So that consists of dispensing medications, counting out medications, counseling patients, as well as some more clinical services. Other rotations are a little bit more clinical based, so a lot of them are based out of hospitals, where we kind of review dosing of medications in the hospital while the patients are staying there, as well as look at drug interactions and make sure we have a full list of home medications, allergies, things like that. Other rotations consist of looking at dosing for blood thinners and even some elective rotations where I've seen stuff with insurance companies as well as management for pharmacy.
Could you tell me more about the internship opportunities you have as a pharmacy student?
Most students will work while they're in class, so you can be an intern at any pharmacy. As soon as you start classes, you can work in a pharmacy as a tech before, but once you start taking classes, you're allowed to be labeled an intern, which just allows you to do a couple things that a tech can't do.
The characteristics of a good pharmacist, I think, are to be organized, to be able to multitask, to be able to talk to patients, talk to doctors. So obviously you need to like to talk to people and have good communication skills, and as well as being able to focus on the details.
Could you tell me more about your day-to-day tasks as a pharmacist?
So our day-to-day tasks rotate mostly around patient interactions and dealing with the medications. So bringing up medications to be filled, filling medications, talking to insurance companies if there's any issues that come up while we're trying to fill them, preparing them, and then having them ready for the patient when they come in. There also is quite a bit of interaction with the patient themselves. So explaining to them if it is a new medication, they may have a question that's come up for a new or an old prescription. And also talking to a patient about if they have any needs like over the counter. So if they have a cough, a cold, maybe they have a rash, just being able to help them with non-prescription medications as well. We work in an area where we are sort of at the intersection of a couple things. We deal with the insurance companies, we deal with the doctor's offices, and we deal with the patients. The one-on-one interaction that we get with the patient is unique. So being able to gather the information, process it, understand it, and then make a decision on how to move forward. And in that decision, you also have to communicate with the patient what he or she is looking for. So how it will help them, if there's any disadvantages to a certain decision. So it really is, we're really kind of in the middle, and then we are there really as the patient advocate. So.
What is your favorite thing about being a pharmacist?
For the last 40 years, my favorite thing about being a pharmacist is the people. I love being able to take care of them. That's why I really love retail pharmacy. I love getting to know the people, helping them with their disease states, when they run into problems, seeing what we can do to make things better, making recommendations for even non-drug things they can do, whether it's diet for a diabetic or helping a person stop smoking. But in all these years, it's really been seeing my patients and then their kids and now their kids, and being able to take care of them all.